Hi everybody, this is Nick Roy from Blue Ocean Benefits and Consulting, and today we're going to go on Medicare.Gov and show you how to preview your Part D drug plans for Medicare 2022. Open enrollment starts October 15th. And we're going to start today by going to Medicare.Gov. As you can see, this is the home page right here, and we're going to get right into it. Now, I just want to go over quickly that Medicare.Gov has tons of information. In basics, you can look up all these things about Medicare. It has a handbook that is one of the best written materials I've ever seen for something like Medicare. It's got so much insight and it's really easy to access. It's got forums and other resources and stuff like that. So if you really want to learn more, that's a really good way to start. And then it also has more information on drug plans and more, and regular supplements. And so it's a really awesome website. It's actually one of the best government websites out there, in my opinion. So we're going to start right here on this homepage, and you'll see Preview 2022 Health and Drug Plans. We're going to start right there. So you're going to click on that, and it's going to bring you to this page right here, 2022 Medicare Plans for Part D. And now you can create an account. If you create an account, what's going to happen for you is you're going to be able to save the drugs that you input. You're going to be able to save the pharmacies that you input. But you can also continue without logging in, which is right here. And if you continue without logging in, you can always print it out on your printer or print it as a PDF and save it. So it's up to you if you really want to make an account or not. We're going to today continue without logging in. And then it's going to ask you to answer a few quick questions. What type of 2022 coverage are you looking for? And we're going to be obviously looking for drug plan Part D. And then it wants you to enter your zip code. So you're going to go ahead and do that. And once you do that, you just hit continue. So pretty simple so far. You scroll down a tiny bit, it'll tell you your county. And then it asks you, do you get help with your costs from one of these programs, either Medicaid, Supplement, Security Income, Medicare Savings. We're going to put I do not get any help from these programs right now, but if you do get help from one of those programs, please click the button. And then we hit next. Then it asks for your search preferences. Do you want to see your drug costs when you compare the plans? Yes. Of course we do. And then we want to hit next. Okay, so then this is the screen you're going to be seeing. This is add prescription drugs. So this system that Medicare.gov has is actually very intuitive. So as soon as you start typing in the name of a drug, it'll actually show up pretty quickly, right? So we're going to start with two lower cost drugs to show you how this starts. And we're going to type in simvastatin. And as you can see, I just type in SIMV, and simvastatin shows up right here. So we're going to click that, and we're going to add drug. Now, once you hit add drug, it'll ask you a couple questions about the drug. Here's your dosage, what's your quantity, what's your frequency. So if you take it once a day, your quantity would be 30, right? Once a month, every month, once a day is 30 times on average. You could also do it if, hey, I only take one every 2 days, then you would do every 2 months, or you'd put 15, so on and so forth. Pretty simple there. So we're going to do a 40 milligram tablet, 30 quantity, and once a month for our frequency. And once you hit add drug, it pops up right there, and it's really easy, and it's already saved. So then we're going to add another drug here. We're going to add Synthroid. Now Synthroid, when you hit add drug, has a generic version available, right? So if you've talked to your doctor and your doctor says, hey, you can take the generic version of this drug, that's awesome, because generic versions in general are much cheaper than brand name drugs. But we're going to add the brand name for now, just so you can see the discrepancy between it when we go forward. And we're going to take the set 88, and we're going to take it once a day, 30, and once a month. And we're going to add that to the drug list as well. Now we're going to start with just these two drugs. Now if you have more drugs, continue adding them until you reach, the amount of drugs that you take. And when you're done, fully done with adding your drugs, you want to hit done adding drugs. And then you're going to start wanting to add your pharmacies. And this is where it is very important to make sure that you put multiple pharmacies, even ones that you haven't used or that you don't use, because prices of drugs are different at different pharmacies, and different pharmacies are in different networks for different plans. I know that sounds like a mouthful, but trust me, it's worth it. So the first thing I always do is click add mail order pharmacy. Mail order is actually a really cool service. It delivers it to your house 4 times a year, every 3 months, and it just keeps coming. So it's actually a really good way, and sometimes it can be the cheapest. So what we're going to do is we're going to add CVS, and you can type in the name of the pharmacy right here and hit find pharmacy. And then if you scroll just a little bit, boom, it shows up, and it shows you all the different CVSs around. So I'm going to add this CVS. We're going to go back up here. We're going to add Walgreens. Okay. You'll see it right there. And we're going to add ShopRite. Now these, I'm just adding 3 for now, but remember, if you have more, if you have even a regular pharmacy that's not, you know, a Walgreens or a CVS or a ShopRite, please feel free to add it. It usually is on here. We'll add the ShopRite, and we're going to stop with these 4 pharmacies, and we're going to click Done. So as soon as you're done putting in your pharmacies, you want to hit Done right here, and then it brings you to this wonderful page where it already sorts these plans by lowest drug and premium cost. So before we get into looking at the plans, I just want to show you what you can see. So you can sort the plan by lowest yearly drug deductible, lowest drug and premium cost, lowest monthly premium. You can sort it by insurance carrier. If you're really comfortable with Aetna or comfortable with Cigna and you want your Part D plan to be administered by them, you can go ahead and click that. You can do star ratings, but it's not nearly as important as the other 2 things. You can also do it by PDP, which is Part D prescription drug plans for Medicare supplements and Medicare Advantage, right? So we're going to stay with prescription drugs, and we're just going to stay right here. We're going to scroll down a tiny bit, and you'll see Silver Script Smart RX. Now this is sorted by lowest drug plus premium cost. So not always will the lowest monthly premium be your lowest priced plan, right? So it might be a $7 premium, but this Silver Script might not cover a certain drug. And this is one thing that's very important is different Part D plans have different formularies, which means they have different drugs that are covered underneath their plan. So if you're on a certain type of drug or an expensive drug that might not be covered by Silver Script, it might be covered by, when you scroll down, it might be covered by WellCare, which has a higher premium. It might be covered by Humana, which still has a higher premium. And if we just scroll down a little bit more, you'll see that's the premium right here for AARP, almost $30 a month. It might actually cover your drug. So we're going to go back up to the top, and we're going to go into Silver Script. And as you can see on this page right here, it's got monthly premium listed as $7. Yearly drug cost at a retail pharmacy would be $602.75, and a mail order would be $640. Your deductible will be $480. And then another really important thing is right over here. It says pharmacies. 2 out of 3 of your selected retail pharmacies are in network. That's a very important thing, but as you'll see as we go into the details. So if you see a plan that you might like to look at, just hit Plan Details. And it brings it all up into one big page for you, and it's really great. So this right here up at the top, as you can see right here, covers 2 of 2 drugs. That's very important. You want to make sure that your drug is always covered under a plan, or else you might want to look at a different plan. So if we scroll just a tiny bit here, it goes over what we saw on the front page, which is total monthly premium, drug deductible, the plan address, which is where it is administered from. And then if you scroll down a tiny bit more, you get into the drug coverage. And now we're going to talk about pharmacies. And this is what I was telling you before. ShopRite is a preferred in-network pharmacy. CVS is preferred in-network pharmacy. And mail order is preferred. If you really like to get your drugs from Walgreens, it's an out-of-network pharmacy. So this plan, Silver Script, would not be for you. And if you keep scrolling here, you'll see yearly drug cost. It tells you exactly how much each drug is going to cost. Now, simvastatin, the generic version, right? That was a generic. $12 for the year, so $1 a month from ShopRite, CVS, or mail order. The difference, as you can see, is Synthroid, right? $507 for ShopRite, $506 for CVS, and $504.40 for mail order. And if you just look at Walgreens, simvastatin is going to cost you $1,700 for the year, while ShopRite, CVS, and mail order will cost you $1. That's why it's very important to make sure that the pharmacies that you want to use are in the network. And if you really are used to going to CVS, or in this case, you're used to going to Walgreens, you're going to want to, if you're on simvastatin, that's not a drug you want with this plan, specifically this plan, right? So we're going to scroll down a little bit more, and you'll see estimated total drug and premium costs, right? So that's for the year. That's what we saw on that front page as well. So the total drug cost plus your premium per month, which this one happens to be $7, would be $603.93. You're going to meet your deductible in November, and you won't enter the coverage gap for this year. Walgreens, if you chose to get your drugs from there, which would not be a very smart idea, as you'd be paying 400% of the other 3, you would meet your deductible in April, but you wouldn't enter the coverage gap. CVS, $602, mail order $600, right? So that's a very simple thing. And also this is really intuitive. So if you're not understanding what the coverage gap is, you just click this and it'll tell you, also called the donut hole, you'll pay no more. So it's got some really intuitive stuff that can help you out while you're on the go here. We're going to scroll down a little bit more, and this is one of the most important ones, and it's really good for budgeting purposes for many people. Estimated total monthly drug cost. If we went to ShopRite, our estimated total monthly cost for both drugs, right, and getting one prescription filled each month for one drug a day for each drug, $45.75 for ShopRite, $45.55 for CVS, and $135 for mail order. Now, mail order doesn't have anything for February and March, and that is because it is spread out over 3 months, as I mentioned before, so don't worry about that. It'll just add up 4 times, $135, $45, and then at last in October it'll be $110.05. Now, as you can see in both the ShopRite and CVS, ShopRite being on the left and CVS being here, we're excluding Walgreens, which is the higher price. In October, that's when they both stop being $45.75 and $45.55, and it drops to $39.50 from ShopRite and $40.42 from CVS. And then in the month of December, $22.93 from ShopRite and $22.83 from CVS. That is because, as we mentioned before, you met your deductible in October based on these drugs, and your deductible then helps you lower your costs as you go to the end of the year, but it's only $600 throughout the year, which is actually a really good price. And then it has even more estimated drugs during the coverage phase. You don't have that, so that's good. And then in here, as you can see ShopRite, you can see exactly how much the retail cost would be for each drug before the deductible, cost after the deductible, which is what we just discussed, how much it would cost in the coverage gap, which is no more than 25%, after the coverage gap, $9, right? So you can see a lot of good information. Now, once you see a plan like this and you say, okay, I want to see another plan, right? Well, we're going to scroll back up to the top, and you say, you know what, I want to see another plan, but I want to keep this plan. I want to keep it safe. Well, just go up to print, and you can print it as a PDF or print it to your printer, and then you have it. And it's everything that we went over. It's everything in there, and you can keep it all, and then you could take it side by side and compare. And another really cool thing is you can go straight to the plan website. If you say, hey, I want to look at Aetna, Medicare, SilverScript, SmartRx, go ahead and click plan website, and it'll bring you right to it. Right? Really, really intuitive system. So then you can go back to search results. And remember, we said 2 out of 3 of pharmacies are in the network. So we'll just scroll down and we'll just look at WellCare. Now, the cost is going to be about $50 more, right, than SilverScript. But 3 out of 3 pharmacies are in the network. So if you say, hey, well, I really want to go to Walgreens, and obviously SilverScript doesn't have it, we can look in here, and you can see that Walgreens is a preferred in-network pharmacy here. All right, $0 for simvastatin, which is really good, but you're going to pay about $50 more, and I think that would mostly come in with the premium going from $7 to $12. So that's about what it would be, right? So it's about $60 more based on the premium. And then you can see what you'll pay each month through this plan just as well, $43.94. $43.94 drops off in November and December because you met your deductible. So it's a really awesome website to be able to go in and look at different drugs. And, if you're not sure if you're going to be on a drug, you can go in and even look at how much it'll cost you. And it's really interesting. It's one of my favorite tools in Medicare itself. But we're going to go back and add one more drug, Zoloft. And we're going to add the brand and not the generic, because I want to show you guys the difference. We'll go with a 50 milligram tablet once a day. I will add it to the list. Done adding. We have our pharmacies already saved in. We'll hit done. And now, as you can see, the price went from $600 to $1,800, and I'm going to show you exactly why right now. So we'll go right back into SilverScript as we just looked at. Right up here at the top, you'll see right away why that's going to be a problem, SilverScript. It only covers 2 out of 3 drugs, and on the last one, we knew it was 2 out of 2. So obviously, the drug that we just added, Zoloft, is not going to be covered. And we're going to scroll down to our favorite parts, which is yearly drug and estimated total drug cost. As you can see, Zoloft at the bottom right here of the yearly drug is $1,294. It's a very expensive drug. So that's what you're going to pay for the year. So about $100 a month, right? And if we go scroll down, you'll see it down here. And you might say, well, it's $153 and I'm still going to meet my deductible in November. That's because this drug isn't covered by this plan. So sometimes the cheapest plan, based on premium, is not always the best plan for you. So we're going to go to WellCare, and we're going to look at that and see what that does. It's still 2 out of 3 drugs, right? Another 2 out of 3 drugs. So we're going to assume, again, that it's Zoloft, as it is the most expensive one. And, of course, it is. It is Zoloft again. Now, you'll be paying for Zoloft out of your pocket, and that's why it's very important to look through each plan and make sure that they either cover your drug or they don't. We're just going through to check and see if any of them cover this drug, right? You're going to want to be able to look at this and check it out, see which ones are going to help you out or not. We'll go all the way down. We'll go down to AARP and check that out. 2 out of 3, right? So this is why it's super important to make sure you're looking at your drugs and exactly what is in the network, what is not. It's really important. We're going to add one more drug here before we finish up. We're going to add Ozempic, and we're going to take off Zoloft so you can see Ozempic. And we're going to go to Done Adding Drugs. We have our pharmacies. And now we're here again. SilverScript is 25. 3 out of 3 drugs are covered. Now you might say, hey, Zoloft cost less than this was going to cost. Well, that's right. But if we scroll down, you'll see why. Ozempic is a very expensive, right? So if you went to Walgreens, it'd cost you $1,000 a month because it's out of network. And that's what, if you didn't have the plan, it'd be $1,000 a month from Walgreens. So just by going to your preferred in-network, you're cutting your costs, right, by $12,000 to about $2,250, which is about, what, $12,250. So you're saving about $10,000 by going from Walgreens to ShopRite. And as you can see throughout here, now look when you meet your deductible, right? You're going to meet your deductible in January. You're going to enter the coverage gap in May, and you'll be out of the coverage gap in December, right near the end of the year. And if you do mail order, you'll never come out of the coverage gap because you only get the last one in October. So if we keep scrolling down, so the estimated total monthly cost, look at this, right? So you meet your deductible in January. So in January, you're going to pay a lot out of pocket, right? You're going to pay $527. But then it goes down to $68.93 because you already met your deductible because of how much Ozempic costs. Then it goes back up because you go into the coverage gap at $169, pay no more than 25%. And then if you see, boom, in December, you go back down again. So it's a tricky game, and you always have to be making sure you're doing the right thing and going to the right pharmacy that's in network. It's a super important thing to make sure you're taking account of. And it's just we just love this website so much because it really is really easy for you to go on there and check it out. We're looking at 2022 plans, but you can always go back and look at 2021 plans. Same type of deal. And the reason the price is lower is because it only shows you the last 2 months of the year, November and December, and you're not going to meet your deductible, obviously, because it's only 2 months, right? So that is Medicare.gov's Part D. Part D, I would call it a application. It's a really cool website. It really helps you out a lot, and they have so much information on there for you. Easy to save your stuff. You create an account, easy to save it. I just want to show one more website, which is wellrx.com. WellRx is a really awesome website. As we go, we can type in our drug, Ozempic, and we can type in our zip code. And so this website, what's really nice about it is that it does not count. What's not nice about it is that it doesn't count towards your Part D deductible or anything like that. It won't count. But we talked about it being $1,000 a month, right, out of network at Walgreens. If you are really uncomfortable with something like that, but you really like to go to Walgreens or ShopRite or whatever it is, you can go onto this website and look at all your drugs and try to find coupons like this, right? So it's $847.80 at ShopRite. So you'd save $150 if you didn't have a Part D if you were going to Walgreens. Really awesome website as well. It has this for a lot of different drugs. You can go on there and try to figure it out and see what's good for you. Another good way to maybe find to save money on expensive drugs is to call the maker of the drug and see if they have any assistance programs or stuff like that. So there's a lot of different ways to get around the high cost of the drug plans. And one thing we have to remember too is that generic drugs do not count towards your deductible. So your tier 1, your tier 2 drugs generally do not count towards your deductible, which is what when we were looking at the drug plans before, a drug like, let me just scroll down and show you, a drug like simvastatin does not count towards your deductible. So if you're on a bunch of generic drugs, you're just going to pay that low monthly premium, right, of like $1 or 80 cents. And once you go up into tier 3, 4, 5 in the specialty drugs, prices are going to go up. And that's just how it goes. So one really important thing is to always ask your doctor if there is a generic version of the drug you're taking, because it'll save you money out of your pocket. And especially in Medicare, that's what we're trying to get you to do, is try to help you get the best coverage, the best drugs for as cheap as possible, right? So sometimes people are more comfortable with the brand. That's totally okay. But we like to see if you can take the generic and you're comfortable taking the generic, that you should do that. The last thing I just want to show you is blueoceanbenefits.com, our website. We have a lot of cool resources on here as well. We're going to be adding more videos such as this one to our online benefits portals and stuff. And right here is the videos. We have blogs we post every once in a while, or who we are. I'll show you me on this page. Really cool. I'm right here, Nick Roy, account executive. My LinkedIn is right here if you need to get in touch with me. So is my email, which is the best way. And then not my cell phone, but my work phone number is 732-759-2836, extension 4703. Again, that's 732-759-2836, extension 4703. This has been Nick Roy from Blue Ocean Benefits and Consulting, and I want to thank you for watching, and we'll see you in the next video.